Morning, everyone. It's been 128 days since Chinese Dr. Ai Fen, the director of the Wuhan Central Hospital's emergency unit, shared information on the internet about a patient with a SARS-like virus. Her colleague, Dr. Li Wenliang, shared Dr. Ai's report online with medical colleagues. The next day, December 31st, regional health officials in Wuhan indicated they were treating dozens of patients with an unknown viral pneumonia. And within days, Chinese officials detained Dr. Li, 7 others, for spreading false statements on the internet. China saw then that it had an emerging public health crisis on its hands. They knew. China could have prevented the deaths of hundreds of thousands of people worldwide. China could have spared the world a descent into global economic malaise. They had a choice, but instead, China covered up the outbreak in Wuhan. Its National Health Commission ordered virus samples destroyed on January 3rd. China disappeared brave Chinese citizens who raised alarms. It deployed its propaganda organs to denounce those who politely called for simple transparency. And that brings us to today, 120 days on. China is still refusing to share the information we need to keep people safe, such as viral isolates, clinical specimens, and details about the many COVID-19 patients in December 2019, not to mention patient 0. Our truth-telling and calls for transparency aren't about politics. It's not about bullying, it's not about blame. It's about the ongoing need to save American lives. This is an ongoing threat. Today, ask medical professionals in New York City. I think they'll agree with that. We need countries to share reliable data in a timely way, now and the next time that a calamity like this hits. We need reliable partners. As a result of China's choices, countries are starting to understand the risk of doing business with Chinese Communist Party and taking action to protect their people. A few examples. In recent weeks, Nigeria, Kazakhstan, and France have demarched the Chinese Communist Party ambassadors for a whole host of lies and misdeeds. Spain has returned defective test kits made in China. That country, the Czech Republic, other nations have received shoddy PPE as well. The Australians and the Swedes have called for an independent review into the outbreak. And my friend Dominic Raab has said that the United Kingdom can't go back to, quote, business as usual, end of quote, with Beijing. Even the EU's foreign affairs chief admitted that Brussels has been, quote, a little naive, end of quote, about China. I'm heartened by this newfound realism. The free nations of the world are starting to understand that China doesn't share those democratic values that we hold dear, or their economic interests, and that this matters to the entire world. There's no true win-win with a communist regime unless you get to the fair terms that President Trump has talked about and the reciprocity that President Trump did in the Phase 1 trade deal. Now countries have a chance to further insist on what's right for their people. Today I want to call upon all nations, including those in Europe, to support Taiwan's participation as an observer at the World Health Assembly and in other relevant United Nations venues. I also call upon WHO Director General Tedros to invite Taiwan to observe this month's WHA, as he has the power to do and as his predecessors have done on multiple occasions. Turning to the subject of those who are trying to do good around the world. Today, the United States is committing an additional $130 million in global health and refugee assistance, bringing our total devoted to fighting COVID-19 to more than $900 million in more than 120 countries. Congress has provided $2.4 billion in total. This new tranche of funding provides more than $40 million in additional funds for countries in the Indo-Pacific, prioritizing places like India and Bangladesh and Indonesia. We'll also provide more than $20 million in global health assistance to Africa, with major investments in South Africa as well as in South Sudan. We've allocated $11 million in contributions to the IAEA as well to support 83 member states in their fight. I'm also happy today to announce $225 million in additional emergency aid to the people of Yemen, separate from the COVID-19 assistance that I just mentioned. This assistance will provide the UN World Food Programme's emergency food operation in southern Yemen as well as a reduced operation in northern Yemen, which the WFP was forced to scale down earlier this month because of the ongoing interference of the Iran-backed Houthis. Whether it's our work in countering diseases like HIV/AIDS, malaria, TB, and now COVID-19, the State Department is very focused on saving lives. And by implementing the Protecting Life and Global Health Assistance policy, President Trump's administration has gone further than any in history in making sure that tax dollars do not subsidize the global abortion industry. We'll continue to do that. A couple of quick items, and then I'll take a handful of questions. First, I mentioned Hong Kong last week. Right now, we're delaying our report to Congress that will assess Hong Kong's autonomy to allow us to account for any additional actions that Beijing may be contemplating in the run-up to the National People's Congress that would further undermine the people of Hong Kong's autonomy as promised by China when they entered into the agreement with the people of Hong Kong. Also, I'm excited to report that negotiations on the U.S.-UK Free Trade Agreement are now underway, something President Trump has sought for a long time. A few matters related to the Islamic Republic of Iran. Last week, the United States sanctioned an individual and his company who were doing business with the IRG Quds Force for years, generating revenue and resources for their terror campaign. Anyone conducting business with Iranian entities should exercise extreme caution to ensure that they are not working with the IRGC. And I'd like to take this moment to commend our German friends for banning Hezbollah and taking strong action against suspected Hezbollah supporters. Hope that all other EU member states will follow. Our gratitude also goes out to Switzerland, the United States protecting power in Iran for now 4 decades, for its efforts to extend Michael White's medical furloughs, seeking humanitarian furloughs for Siamak Namazi and Morad Tabaz, and bringing home all U.S. citizens wrongly detained. We welcome their assistance and we appreciate all that they've done. We're not the only nation whose citizens are subject to Iranian regime's brutality. I was appalled to see reports last week of Iranian guards on the border of Afghanistan's Herat province abused, tortured, drowned Afghan migrants who dared to cross the border simply in search of food and work. We encourage the Afghan authorities to undertake a full investigation and to seek to hold those perpetrators accountable. Let me close on an upbeat note by mentioning 2 human rights victories. First, the United States was pleased to see the transitional government in Sudan take the first steps to ban female genital mutilation and cutting. It's a big step, a bright step closer to a future in which all women and girls worldwide won't have to suffer this barbaric practice. It would be great to see nations like Somalia, Equatorial Guinea, and Djibouti, where FGM is widely practiced, follow Sudan's lead. Second, it's only fitting that on the same weekend as International Press Freedom Day, the family of Daniel Pearl successfully challenged a lower court ruling that overturned the conviction of 4 individuals responsible for Danny's kidnapping and murder. We welcome the government of Pakistan's commitment to ensure that justice is done in this case, including by filing their own appeal. Finally, while on the topic of South Central Asia, I want to give a shout out to one of my colleagues, Alice Wells, as she prepares to depart the State Department. She's done remarkable work. I've worked closely with her. She is an exemplary diplomat who for more than now 3 decades has served the American people. I want to wish her all the best in her future endeavors. Happy to take a couple questions.